We look at the pharmacotherapy of hyperlipidemias. So hyperlipidemia is just basically you are having levels of what? Bad lipids, that's cholesterol, and the levels are too high. So pharmacotherapy is more of like, how can I use drugs to be able to treat these conditions of somebody having high levels of lipid in their body? Okay, so we're looking at what? The various classifications of drugs that we use in treating these issues. So pharmacotherapy for hyperlipidemia just involve drugs that will lower bad lipids in your system. So you have high levels of what? Bad lipids in your system. So you want drugs that will lower it. So they reduce the effects that that drug would have had on your heart. So the various examples, we have the statins. Examples of statins include what? Atorvastatins, rosuvastatins, simvastatins, So they inhibit cholesterol synthesis in liver. They upregulate what? Low density lipoprotein receptors. Okay, and they lower low density cholesterol, lipoprotein cholesterol. So effect, the low density lipoproteins that are bad will be what? Decreased. Triglycerides will be decreased, while the high density lipoproteins will be what? Increased, because they are the good ones. So they are the first line of treatment for all those hypercholesterolemia, where somebody's having all those hypertension, cardiovascular issues. Okay, let's go. Then for the next example, we have drugs like the word Ezetimibe. Okay, inhibits intestinal absorption of cholesterol. This one is directly on the intestine to stop the intestine from what? Taking in cholesterol. So it's to lower the low density lipoproteins for, to be specific, it has minimal on high density lipoproteins. Okay, so you can combine this drug when you want it to work more. Then we have the PCSK9 inhibitors like the Alirocumab or the evolocumab. You know, there are monoclonal antibodies. They block the PCSK9, which usually increases, you know, this will now increase the receptor recycling, and it will clear the low density lipoproteins more. So it will decrease low density lipoproteins up to 60%. So it's mostly used for all those familial cases where there's like inheritance in a particular family. Then we have bile acid sequestrants. So drugs like the cholestyramine, the cholestyramine, the cholestyramine. This one, they bind bile acids in the intestine. They prevent reabsorption of this. Do you understand? So it will now lower the cholesterol. Sorry, liver uses cholesterol to make more bile acid. Do you understand? So the cholesterol is now being used more, so it doesn't have time to accumulate in the body. Next example, we have fibrates. So drugs like the what? Gemfiprozil and the fenofibrates. So they activate the PAR alpha. This will increase lipoprotein lipase activity and fatty acid oxidation. Okay. Next, we have the niacin, which is nicotinic acid. It will inhibit hepatic very low density lipoprotein synthesis. So to lower low density lipoproteins, it will lower triglyceride. It will increase high density lipoproteins, which are like the good ones. The newer ones, we have things like the bempedoic acid, we have the glycerides, then we have the omega-3 fatty acids.